going to demonstrate the application of a dressing called OxyBand. This is a patient that had a full thickness skin graft to an excisional site for removal of a carcinoma. The graft has partially failed, as you will see, and we're managing it with hyperbaric oxygen therapy as well as OxyBand. The patient had a 4-day weekend without hyperbaric, and at which time we used the OxyBand. I'm going to demonstrate a unique application technique here. I have already shaved this area of the head to allow for better adherence of the dressing, but what we're going to do is we're going to apply some hydrogel. This is a simple hydrogel that has some free radical scavenging properties to it. We're going to moisten that graft. I'm going to apply a gauze over the top. This has been impregnated with hypochlorous acid. We'll put that right over the top to maintain some moisture at the graft site. Next, we're going to take our OxyBand dressing. This is packaged with 100% oxygen. You open the dressing up to reveal the contents. Inside the dressing is a foam that can be used, and we're going to apply that today. I'm going to basically cut that foam to the same size as the 2x2 we have on there. The OxyBand dressing is a reservoir that contains 100% oxygen inside this envelope. It passes in a unidirectional fashion. This is impermeable to gaseous diffusion. This membrane here is actually capable of allowing the oxygen to slowly diffuse out from the reservoir. So this surface here will allow oxygen to permeate through out of the reservoir to the wound dressing. The tricky part of applying this dressing here is the nature of the area. Like I said, I've already shaved it. I'm going to use a little skin prep. This will just prepare the peri-wound skin, give it a little bit more ability to stick. And as with all dressings, we customize the dressing to match the patient's needs. Then we're going to take the OxyBand and apply it right over this area. Most important thing we want to do is we want to achieve a seal, because this is an airtight dressing. We don't want leakage from around the borders. You work the dressing down, and what I find is that you work it all the way around. And keep working that around. In this area here, we're going to take off that border margin. And we're going to seal again. You see, we've now obtained a seal all the way around. And that's probably sufficient. However, what I want to do is I want to reinforce a couple of these margins with some tape just to keep that in place. So I'm going to reinforce that margin with some tape. And again, this is basically being done just because primarily the location of the wound. This is obviously a difficult area to get the dressing to conform to the margins roll. So we're giving a little reinforcement. Make sure you cut your tape square so it looks pretty. And there you go. We now have the OxyBand in place. We're going to leave this just like we did the last one for 4 to 5 days. Patient's going to be getting hyperbaric while he's having this dressing in place. So this OxyBand works not only as a bridge dressing when the patient can't receive hyperbaric, but certainly can be used at the same time as a hyperbaric treatment.